and welcome to this another coMra webinar. So today the topic is going to be questions and answers. We get a lot of different questions about coMra therapy, and we had some we didn't get to last time, so we thought we'd open it up this time so everybody could have an opportunity to ask questions. So what we'd like to do is ask the question. If you want to put it in the chat, go ahead. But we're going to ask you to come on with your microphone because it'd be nice to chat things through. And also, in the spirit of self-sufficiency, we're going to help guide you to somehow answer, if possible, your own question, because a lot of us have, we all have a lot more knowledge than we actually know we have. And this is a process of more or less claiming, stepping into that knowledge, and really learning to trust ourselves and our intuition and our own, let's say, take on things. And we can help corroborate that for you. And if there's something that we see, well, how about, did you think of this, or try that? And we can make some adjustments to that. And also, just to note, because this is all in the spirit of, helping us all be self-sufficient. And self-sufficiency, remember, this is a synonymous word with holism. And so holism means, we have a bigger picture, more whole. And this is what we're all really striving to do at the end of the day in one way or another in our lives. So what we're going to do today, we're going to start Arzhan Surazakov. For those of you who don't know, Arzhan is our Director of Research and Development at Radiant Life Technologies. He's our scientist, our head scientist. And so he's going to go through a presentation just to set, let's say, the framework for today. And that's going to be to touch on some things about treatments and how-tos and this sort of thing. And then after that, we're going to get into the Q&A. And with that, I would ask you to please, like I said, you can put your comments in the chat. I'm going to be paying attention to them as best I can. But it'd be nice if you wrote them all, let's say, to everyone, unless it's something really pressing and you don't want to and you just want to write to me, okay. But I prefer if you wrote to everyone. And then we're going to get to the questions at the end. Now, you don't have to write in the chat if you'd like to talk about it. We will definitely, we welcome that, because even those of you who put them in the chat, I'm going to ask you, can you elaborate a little further or whatever, and we get to the questions that way. So I think that about covers it all. So without further ado, Arzhan, if you would, please. And if I didn't, if there's anything else you want to touch on, obviously, please include that. Okay, thank you.
Thank you, Gareth. Good evening, everyone. It's 7 p.m. here where I'm in Russia. And good morning and good day. Yes, today we decided to take a simple approach, a light approach, not simplistic, but light. And this is so because actually coMra therapy is all about getting to know yourself, getting to know your own body, learn how to work with it. And Delta is palm device coMra therapy is actually a tool to help you in that process. So in essence, when we study how to treat, what to treat, how to use coMra devices, and then we train other people how to do that for themselves. Yes, it's a process of getting to know your own body. And this process is actually very simple. We try something new. I'm talking about, let's say, a coMra treatment. We see how it works, and then we change and repeat. So it's really a process of discovery. It's a very gradual process, and there is really not many mistakes, not much mistakes actually can do in this process. So it is very simple, very self-sufficient process actually. So in the next 20-30 minutes, I will cover the basics. So we are sort of starting from the same page, and then when questions will arise, we can come back to some of the slides to answer more in detail if you have specific questions about the slides in your specific case, for example, and so on. Okay, so let's start in the beginning. perhaps the very first question that we would get is, can I treat this condition? Can I treat that condition and that condition? But what about my shoulder? What about my kidneys? What about my head? And we say, yes, you can. Yes, we can treat that. You can treat that. And sometimes people wouldn't get it. How it's even possible? Because we've been trained, we've been raised to learn that, for each specific, problem, there is a specific solution. This is the whole process of diagnosis is all about, to establish, what's wrong, what's causing the condition, what's causing the symptom. And once we're clear, we apply a specific tool to address the problem. So, and this is how we've been, at least in allopathic, in mainstream medicine, have been trained and actually learned along the way. In alternative medicine, in Chinese medicine, in Ayurveda, there's a different approach, but still, we need to identify where and how we would approach a problem. coMra therapy, in this sense, is the same, and yet it's slightly different. So I would like to show you this slide, and actually let me make it big so you can see it closely. I made this slide to illustrate the difference. What is the difference between, the traditional approach, which could be, for example, surgery, medication, other methods, and coMra therapy, how they relate to each other? Well, at the center of this question is the issue of addressing cellular injury. So when disease manifests, one way or another, we always talk about some sort of injury to the cell. And when we're trying to tackle the cause of that injury, that's when we are fighting the disease. We can call it fighting a disease or trying to eradicate the cause of that cellular injury. So if there was a trauma, well, obviously we need to remove the cause, of trauma. If there's infection, then there are special medication that addresses that specific pathogen. So, if we talk, for example, COVID-19, we know that we cannot take antibiotics for the coronavirus. That's because it's a different type of pathogen. It doesn't make any sense to take antibiotic, and so on. If there is a toxicity in the body, so there are very specific methods to remove those toxins, lack of nutrients, and so on. So these methods, I call in general, very general, fighting a disease, addressing the pathogen, the cause of cellular injury. That's one side of the story. But then there is other side of the story, which is the body itself. What I mean by this is that all the time in the body there are processes of self-repair, self-maintenance. They are happening every living second of our life. From the birth until we die, these processes never stop. They focus on growth, on repair, on adaptation, on self-maintenance. So these processes are not specific to a disease. See, that's the difference. These processes are our most fundamental, most basic things that are happening in our body. So coMra therapy, what it does, it supports the process of self-repair, of the regenerative process. It does not address the pathogen, the trauma, the infection, the toxicity, and so on. So when you think about these different methods and how we can think about coMra therapy, how to place it, this is the picture to keep in mind, actually, that these are not one and the same thing. These are different sort of the facets of the healing process. And both methods of fighting the disease and methods for supporting the body has their role, but they're different. Okay, so if later on there will be questions, then obviously we can come back to it. So when they think about what can I treat, what conditions can I treat, again, coming back to the same question, it really doesn't matter what kind of disease you have. It could be trauma, it could be infection, it could be you overworked, for example. It could be age. Any type of condition where body is experiencing a stress. And again, there are all kinds of conditions. So the body has to engage adaptive processes in order to cope with that external load. So whenever this happens, when the body is engaging its internal resources, this is where coMra can come in. So really, we're talking about everything from treating the disease, preventative treatment, working with the chronic conditions, working with the newborns, the elderly, all the way through. coMra therapy can come in. And again, it's not specific to a certain pathogen. It's not specific to a certain cause of the disease. Instead, it helps the body to recover, to repair, to restore functioning of the immune system, and so on and so forth. So really, when the question is, can I treat condition XYZ? Almost always the answer is yes. Okay. And coMra therapy works by actually raising the quality of life. If we think about what's happening in the body, the enormous multitude of processes that's happening inside, when you put on yourself a coMra device, you're not changing anything. Actually, what's already happening in the body. Instead, you're raising a quality of that process. So it happens faster. The body can overcome the stress much more easier in a shorter time with less severe symptoms. So this is to keep in mind. coMra therapy, in essence, is healing by raising the quality of life in a very literal, biophysical, biological sense. Another question which sort of comes next to it, okay, so coMra therapy works and can help me for all kinds of conditions, but is it actually safe? No, because we always got used to weighing, what's the benefit and what's the risk. And if the benefit outweighs, then okay, I'm going to use this technology, this device, this medication. So the question is coMra therapy safe? But again, the answer comes directly from the previous point, which is coMra therapy doesn't change, it doesn't forcefully manipulate your biology. So let me go to this slide and actually show you what I mean by this. I used this slide in the previous webinar about the coronavirus disease, but again, I will use it just to demonstrate. Again, with medication, we are trying to find that specific gear in the disease mechanics, and we want to influence it directly. Remember, we want to address the pathogen. We want to manipulate the process how the body is getting sick. So this is why the medication has very specific target, and almost always it will have certain limitations, side effects. With coMra therapy, we're working on the functional reserves on the cell. In this case, it shows here immune cell. So we're increasing the energetic reserve, we're increasing metabolic reserve, we're helping the body to regulate itself more easier, and then the intelligence of the body takes care of the rest. So we're not forcefully adjusting anything what's happening in the body. We're just supporting through quality, remember, through coherence, to make it easier for the body to do the process of self-healing, of self-repair, of immune defense, of regenerating the damaged tissue, regenerating the joint in the knee, for example, and so on. So I hope that it's clear that the safety of coMra therapy is inherent by its own design. Now, of course, remember, there are rules how to use a coMra device. And the first rule is to never look into the working device directly through your eyes, because there's a laser working and you can see it, so it can damage the retina of your eye. And there are other safety precautions listed in the user guide, but they are in terms of handling the device, not in terms of the application, how to treat yourself. So it is really, really safe. Now, very often, when people learn about low-level laser therapy, in Russia they practice so-called magnetic infrared laser therapy. They learn that, these radiances, they enhance the growth. The recovery is so fast, my burns are healing so fast. So it almost like whenever you point the device, whatever that place is, then it will grow. And of course, the first concern is about cancer. What if I put, what if that bump, it has some, is a tumor, it's a benign, is it not benign? So it's a lot of concern in that area. So I would like to say that during the last 50 years, just imagine how much research has been done, how many studies has been done to establish firmly and fully that low-level laser, when applied properly, including MEAL therapy and coMra therapy, which is even less energetic input, completely safe in oncological process. What I'm showing on the right is a book. It was published, I think it's about a month ago here in Russia. It says Laser Therapy in Oncology. It's published by a scientist from Moscow. It's 1,300 pages long. It lists 2,300 references. The bottom line is laser therapy, coMra therapy is safe. Moreover, you can treat cancer, you can use coMra therapy, laser therapy together with other methods of cancer therapy. So it is completely safe. It doesn't have these inherent carcinogenic properties. So that should be really, really clear. Okay, next question. So it can help me. There is no risk involved, but how do I treat myself? And then again, it's actually easy to understand where people might come from, because again, we grew up used to methods of treatment which are inherently dangerous. I mean, you can overtreat. If you take a drug, you can actually do things much worse. And I'm not even mentioning, more invasive methods of treatment. So there is a concern, how do I treat myself and so on. Of course, there is user guide. When you open user guide, it's always the best point to start. And Garrett, I'm sure, said it 1,000 times. It's a middle of the road, conservative approach, which should work in 95-98% of cases, and then you would adjust it depending on your individual conditions. So the first point of departure is your user guide. Now, when you start getting more comfortable with treatments and you start to have questions, well, what about that condition? It's not listed in user guide. Or what about, for example, when I have both my shoulder is aching, my back is not well, plus my headache, can I combine treatments and so on. So to put it very simply, please experiment. And you can do so starting from two very simple points. One, you treat directly the site of injury. If my shoulder hurts, I don't actually need now user guide. I understand that, okay? I need to put a device directly on my shoulder, so I irradiate from front, from top, from the back, and so on, and I'll treat my shoulder. If it's my head, I'll put the device directly on my head. So first of all, always think about treating directly site of injury. And this is where on your device you will see the different frequencies. On a delta, on palm, you will see there are buttons that switches between different frequencies, 5, 50, 1000 and variable. What they do is you can think about depth of effective penetration. These frequencies have nothing to do with some mysterious resonances with different types of tissue. No, this is very simple. Think about 5 going deep. So these are slower pulsations. They have more time to penetrate deeper so that effect would be deposited in deeper organs. Again, effective depth, not the actual photons, but depth of the coMra effect. 50 is in between, 1000 is skin surface. Now, there are several clarifications in the user guide about the frequencies, but these are the basics. 5 is deep, 1000 is surface, and then you have variable, which is going from the surface all the way down deep. So for example, if it's a trauma to my shoulder and I have something damaged to my skin plus to the deeper tissues, then I would use variable. So really simple. Second, so first was treat the injury directly. The second is to treat the affected system. So what do I mean by affected system? Here I put together, now this is a slide from one of the courses, I'm sure you remember. So by treating systems, we mean when you open user guide in the first section, it says universal treatments. And these are treatments to address your disease systemically. So here on the horizontal axis, universal 1, universal 3, and universal 5. We are addressing diseases which has a very strong component of a neurological, some sort of a neurological, emotional part to it. It's everything which involves our nervous system, our endocrine system, and our blood, obviously. On the vertical axis, you see treatments universal 2 and universal 4/6. These are treatments that are addressing the somatic part, which is your physical body, which is the processes of digestion, expulsion of the toxins, of the rebuilding. So this is your somatic part, the vertical axis. Psychological part is horizontal axis. In between, obviously, we have universal 3. So when you think about systemic treatment, think about your disease, what kind of roots it has. Is it mostly having to do, let's say, for example, you are a sports person, you're running a marathon, so you need to address, the vertical axis. If you're feeling down because of the psychological stress, because of endocrine system disorder, think about the horizontal axis. So it's really basic, really simple. And when you open the user guide and you will see those points, remember that horizontal and vertical axis. But what about immunity? Is there specific treatment for immunity? Well, remember, immunity is a system of relationship between all of the systems. It's not one particular organ or one particular part which plays a role. So in the center, we have universal 3. This is where your immune cells are coursing. This is where they are circulating around the body. So when you start sneezing, coughing, you're feeling down, you would do universal 3 several times a day. Now, if it's more extensive, then you would address all other systems as well. So when all systems are working properly, then your immunity is top-notch. Okay, next question is, for how long do I treat a point? Again, shoulder, heart, kidneys, liver. So when you open user guide, you will see 1 minute per point. It says 2 minutes per point, and people sometimes stick by the second to it. Like they would call and say, "Oh, but what about, I overdone it. I did 2 minutes. I forgot to switch, the timer on the device." Think about a plant. It's actually very easy to understand. Think about a plant, standing next to you. How would you determine how much water that plant needs? It's very simple. You look at it. If you don't put enough water, the leaves will be down. Plant is not healthy. If you're pouring so much water, again, it won't be healthy, it won't be happy. And it's a gradual process. So by gauging how the plant looks, maybe you stick a finger into the soil and you gauge the moisture with it, you'll get an idea how much that particular plant loves water. Exactly the same is with your body. Start with the user guide. It says 1 minute per point. We'll start with it. This is your middle way, the plant in the middle. But then play with it. Try a little bit more, try a little bit less, and see how it goes. If you feel better, you're in the right direction. If you feel no changes, okay, something else needs to be changing. So the 1 minute per point, 1 to 2 to 3 to 5 minutes per point, this is again the middle of the road. But then experiment, try differently and see how it works. The next question comes is, but well, how do I understand, are there specific tests? Do I need to go for laboratory? Do I need to do some analysis? Do I need for X-ray, MRI, and so on? And the answer is yes. Sometimes it's very important to establish what's going on. Let's say you don't have a diagnosis yet, and you have been treating yourself for several days, and the ache wouldn't go away. Okay, maybe I need to do some more investigation, and you would go to a doctor's office for some tests. But by and large, in the majority of treatments of the conditions, quite obviously, you are your own best health expert. And if you pay attention, you will never have a need to go for some extensive tests and images and so on, because all you need to do is just to pay attention to the body. How's your appetite has been lately? And your sleep? Did you wake up fatigued, tired? Did you wake up rested? What about your level of fatigue? Can you work for long hours or just little short ones? How is your pulse doing? What your blood pressure looks like? Your stool? So all the things that are telling you, the body is actually talking to you and says, I'm fine, I'm fantastic, let's go out for a run. Or pay attention, something is going on. Remember when you went to a doctor and they would ask you, how did you sleep recently? How was your appetite? Because for them it will tell a lot about the overall state of your condition. These are most important markers, and they're very simple. Just by being aware of what's going on, by paying attention and providing that love, care after the body, we can actually prevent all the major conditions, problems, difficulties, diseases, and so on, if they catch them as soon as they appear. At least this is how we should learn how to do that. And coMra therapy is a fantastic tool, how to learn that game of trying, adjusting treatment and see how it works, do something differently, and then, okay, so this one works, do it more of it, and so on. So it's a very rewarding process. Okay, acute conditions. Frequent and short treatments. Again, when you open user guide, in the beginning it says, the listed recommended treatment times are very general. They do not apply in acute conditions. What is acute condition? You hit finger with the hammer, it's acute condition. You got flu, coronavirus, that's acute condition. Suddenly everything was fine and you feel down, like no energy, that's acute condition. So everything is fine and then suddenly happens. Apply treatment for as many times as necessary. It means 4 times a day, 5 times a day if necessary. But rather do it in short bursts, short treatments, meaning 5 minutes, 10 minutes, and then have a rest from treatments and repeat it again. Rather than doing, 2 hour, 3 hour, 4 hour long treatment, because remember, like that plant, it can absorb only so much, suck in water so much, and do something with that water, in terms of self-repair, in terms of immune function. And then the energy is expanded, then you add some more water, do the top up. So approach it in this way. Frequent and short treatments. What about chronic conditions? Chronic conditions, something you had for a month, 2 months, 3 years, 5 years. These are chronic conditions. Now, when you start with coMra therapy, start slow. Meaning, open the user guide. This is your starting point. This is the middle of the road approach. And do it gradually, especially the first 1, 2, 3 days. Do it gradually. Observe yourself. What do I mean by this? Well, look at your sleep, quality of sleep, your appetite, your stool, take your blood pressure, take your body temperature if needed. So these are very simple signs to show that everything is fine. You can increase the treatment, if needed. If you feel tired, fatigued, okay, it's too early to increase the treatment. Keep going. So I have that slide. Again, it's from the course. I'll just show it bigger. Remember, what I'm showing here in red, this is the range, let's say, of your activity. 20 is down below, 50 is high up. This is the parameter, what we call the percent of lymphocytes in the blood. So if you have been sick for a long time, if you had the disease for many, many years, then you are most probably in an exhausted state. You are down below, below that red zone where the healing occurs. And when you start coMra treatments, usually the first couple days, after the first couple of days, you suddenly feel this elevation of energy, like the pain goes away, appetite comes back. That's, your body is saying to you, thank you. Finally, I have some energy, some support, and you feel fantastic for the next several days. But then after it, you may feel down. And this is happening because not enough energy reserves is yet stored in the body. Don't stop the treatment yet. Keep going. Keep treating yourself until you reach another good, solid improvement. Again, it will be different in different diseases for different conditions. It may take 5 days, it may take a month, it may take 3 months. But eventually you'll get to the point where you feel significantly better. That's when you take a break from treatment. Let's say first break should be short. 1 week, 2 weeks tops. And then resume the treatment. And then with each up and down, your downtime will be shorter, the symptoms will be less severe, and then over the time you will feel much better. So we're talking about multiple sclerosis, diabetes, conditions like this. They will take time. At this point, Garrett, I have more slides, but I want to stop here. And when questions will come up, I can use other slides and we can talk about them.
Right. Sounds very good. Okay, thank you very much, Arzhan. And we do have some questions in the chat. So I'm going to start with a question was asked about COVID. People die of an immunity shock that overwhelms the lungs. How to use coMra and avoid this, or should we use coMra only before things get out of control? So, did you want to respond to that question?
Very good question. Well, first of all, please watch. I think it was the second webinar we did on specifically how to treat COVID-19. But I thought a question might come up, so let me show you a slide. Okay, so let's go back first to the beginning, which is your immune system. Remember, when we talk about COVID-19, this is a challenge to our immune system. And that part of our immune system which is responsible for tackling new viruses, new pathogens, is called adaptive immunity. And because coronavirus is new to us, to our immunity, it has to spend some time finding that particular key to that new lock. By the day 7, by the day 10, the key is found, and then our body has to manufacture a lot of those specific so-called T cells, B cells. These are part of our adaptive immunity. And when we have enough energetic resources in the body, then the condition will resolve itself very easily. Actually, the vast majority of people will not show even any symptoms because they have enough resources. So let me show a slide. So what I'm showing you is something we talked about in a course about coMra therapy, but now relevant to the COVID-19, I want to show you this slide again. There is a very simple test you can do, anybody can do, when you do your blood panel, is percentage of lymphocytes of total leukocytes, of your total white cells in the blood. So,
Arzhan, maybe just
yeah.
very briefly, because not everybody's familiar with those terms. You can just ask your doctor about this. It's really just markers for your immune system, well, not just, and there's more to it, but yeah, I don't know if you want to explain any more about them, Arzhan.
Yeah, but I'll just mention briefly. It's very easy to see where your immunity is at. When your immunity is strong, we call it training or activation response. These are normal healthy status. When your immune system is in stress condition, that's when it's a cause for concern. So you see, when your percent of lymphocytes from 0 to 20 this is when the challenge comes in. So for example, this is a study from China, came out a week ago, and they looked at the patients with different status of immunity. Again, remember, think about your immune system. When it's strong, it's tackling the infection just fine. When the immune system is weak, it doesn't have enough resources, then the problem happens. So in orange color, you see a progression from day 1 when you get infected to the right. You see days after disease onset. So in orange color, you see people who had moderate symptoms and they recovered quite quickly. So you see the percentage of lymphocytes is from 20 to 40. This is a normal range. So somebody, who is healthy, strong, no other chronic conditions, and they would go for this disease even maybe not knowing about it, because the immune system is perfectly capable of tackling the disease. So this is basically, I'm showing you the indicator, that when the immune system is strong, you're good. Now, in black color, we're seeing patients, you see in the beginning of the disease, they had their percentage of lymphocytes from 10 to 30, sort of down there, a little less. So these people, when they got the infection, the virus, let's say they had diabetes, they had hypertension, they had some other chronic condition. So the energetic reserves are less than optimum. So by day 7, look at this, by day 7 or 10, this is when your adaptive immunity kicks in. This is when your T cells, they found the key to this new virus. They're going to roam around the body, hunt those infected cells, kill them, eradicate infection. Is your T cells, remember? The lymphocytes, the specific adaptive immunity. But by day 10, they drop down somewhat. And then, by the end of the second week, third week, in black color, they had, moderate to severe symptoms. Maybe they had to go to the hospital, but eventually they recovered. And that's by day 30, by day 36. Eventually they got recovered. The immunity sort of overcame the infection. Now, in other conditions, when your immune system initially, again, remember, before the disease, was compromised. It could be chronic condition. It could be initially healthy person, but let's say they ran, they worked for 2-3 days without sleep. They had psychological stress, which is hugely taxing on the immune system. They had problems with sleep and so on. So in blue color, you see that by day 10, the adaptive immunity has no power. It drops down to 5, 10, 2, 3, 4. So in blue color, these people died as a result. You see, by the end of second, third week, when you drop below 5, that's when your immunity basically stops working. So this is what's happening when we talk about challenge to the immune system and the coronavirus. So with coMra therapy, what we're doing, again, watch that webinar. All information is there. And actually, I wrote an article which is being edited right now, so we'll send it out in the next few days, where I show the scientific evidence, clinical studies that show that the function of your immune cells can be improved basically by 100% sometimes with low-level radiances, which is the laser, the magnet, the color, the ultrasound. And this is what coMra therapy is doing. It's improving function of your immune system so that by day 7, it's working at full capacity, full speed, and then you recover much better. Now, you don't have to wait until you get the infection, to start treatment. Actually, the much better approach is to be proactive. You do treatments, again, in that article, which we published on our blog. We wrote several preventative treatments, immune support 1, immune support 2. With these preventative treatments, you can get ready your immune system. So when you get infected, you will be, percent of your lymphocytes will be 20, 30, 40. This is where you want it to be. It will be full capacity, ready and strong. And when you get infected, well, you won't feel anything. Or maybe you feel some tiredness, maybe some itching in your throat, but nothing less, nothing more than that. I think I covered it.
Yeah, that covers that very well. So the next question, yes, please, Max.
Can I just one clarification on this question, because recently in some articles, news, they are saying like when you have this lung infection, it is very high inflammation happening. So do I understand correctly that this very high inflammation is not marker of high lymphocytes, but another activity of immune system, like neutrophils, some?
Good question, Maxim. What they call cytokine storm. This is the immune system completely failing to contain infection. This is when your lymphocyte percent, on that graph, is below 5. This is the last stage when basically immune system shuts down, and then in that process, there is a very rapid spread of the virus through the lungs, through the immune system, and there is literal destruction happening. And when cells start to fall apart, they release these markers of inflammation. Basically, it's a runaway train. But again, there are studies, and in my article, I'm showing so many studies that showing when you apply laser therapy and consequently coMra therapy, you can prevent this from happening. They studied people with tuberculosis, with pneumonia due to different conditions, people with cystic fibrosis, children with cystic fibrosis. And when they have hyperinflammation, this is bad. This is bad because of the autoimmune damage, because of the immunity failing to contain the bacteria or the virus. In this case, it doesn't matter. And then there is too much of these inflammatory messages going out. So, but when we apply laser therapy, immune system, our adaptive immune system goes up, it takes care of the infection, and then immediately, very fast, within days, they see rapid, decrease of these inflammatory markers.
Thank you, Arzhan.
Pleasure.